March is Colorectal Cancer Awareness Month. The Colorectal Cancer Alliance estimates nearly 150,000 people will be diagnosed with colorectal cancer in the United States this year. And the age of people being diagnosed continues to drop. According to the American Cancer Society, colorectal cancer usually begins as a polyp or non-cancerous growth that develops on the inner lining of the colon and typically grows slowly over years. Here in Montana, colorectal cancer is the third most common type of cancer diagnosed and the third most common cancer-related death. An average of 498 cases of colorectal cancer are diagnosed in our state each year. 178 Montanans die each year from the disease. Colorectal cancer is personal for my family. My dad, Dr. Richard Newth, died of a very aggressive form of colorectal cancer at just 55 years old. He was a young, healthy, active doctor, the youngest of 4 brothers. There was no history of cancer in our family. We learned that cancer doesn't discriminate. I want to use my family's story to help bring awareness to this terrible disease. So this morning, I'm joined by Lacey Gallagher with the City County Health Department and Montana Cancer Alliance here. Lacey knows my family's story well, and we've worked together to help raise awareness about colon cancer over the years. Lacey, thank you for joining us this morning.
Thank you, Shannon, for making this platform available so people can understand why it is they need to take action.
So let's talk about action now. Screening guidelines, they've evolved, they've changed over the years. The American Cancer Society now recommending people with an average risk start regular screenings at age 45. That's down from they were recommending 50. So let's talk about some of those current screening guidelines.
Yes, let's talk about that. The American Cancer Society is the organization that has recommended people begin screening at the age of 45. We're not quite sure why we're diagnosing people younger and younger. Maybe that has to do with diet and lifestyle, and diabetes, of course, is a concern. But family history is the number one thing that they identify why we're diagnosing people younger and younger. So your insurance carrier is the one that ultimately decides which tests they're going to pay for and at what age they'll begin screening. So it's very important for individuals, if they have insurance, to be talking with their healthcare provider and their insurance carrier on when to begin screening and what their family history is. That's really the 2 key elements that we should discuss there.
And often we see in colorectal cancer, I remember going through with my dad, that sometimes if you're not doing regular screenings or you're younger possibly, you don't notice sometimes the symptoms until they're in later stages, and maybe that's changed now. But what are some of the signs and symptoms that people need to be keenly aware and in tune with their body to watch out for?
Well, the signs and symptoms of colorectal cancer are very subtle. I believe most people can just pass them off as something that occurs in life, but polyps don't have a sign or a symptom. And that's what they're identifying when they're doing a colonoscopy or a testing. So a change in bowel habits, diarrhea, constipation, the consistency of your stool, blood in or on your stool. Your stool is a bowel movement. Abdominal pain, aches, cramps that don't go away. Losing weight that you're not necessarily trying to do. So those signs and symptoms are very subtle. And again, going back and talking with your healthcare provider and making sure they understand your health history are critical here.
And when we talk about screenings, colonoscopy is obviously the big one here, one that's talked about more, but there are some other type of options for screenings. What are some of those?
Well, I think we see them on TV all the time. There's one in particular, but there's something called a FIT test. It detects blood in the stool. It's something you can do in the comfort of your home, and your doctor can provide you with that test. I actually make it available at a couple of centers in our community for people that don't maybe have insurance or looking for another alternative. Then there's the FIT, fecal immune test, that includes DNA that's being combined with the FIT test to detect altered DNA in your stool. So again, you're doing the test in the comfort of your own home. A flexible sigmoidoscopy looks inside the rectum and the lower part of the colon. And then, of course, the colonoscopy is the gold standard. The test is done by a physician, and at that time, they're removing polyps or those precancerous tissues. And those polyps can be very small or they can be very large. And of course, if they're very large, that's usually when an individual is showing those signs and symptoms that they go to their doctor.
Sure. And you and I have talked before too, and I think I've heard you say this, and I use it when I talk to people too, is that a colonoscopy might be uncomfortable, the prep part might not be so fun, but it's easier, it's more comfortable than going through cancer, going through chemo, going through radiation, things like that. So as I've shared before, we had no history of cancer in our family, and my dad had a very aggressive form. So pay attention to your body, ask your insurance, get screening when you can. Lacey, thank you so much for joining us this morning. We appreciate your time and your expertise.
Thank you, Shannon.